So good evening, everyone. Very warm welcome to you all. Thank you for joining us on the Becoming a Doctor page for our live webinar with Dr. Helen Johnson and the East of England Foundation Programme Director and some of the Foundation Year Doctors that have already began. So I'm just going to start by asking each of the doctors to introduce themselves. And as we go through, if you have got any questions, please do feel free to comment on Facebook or tweet us, and we'll be sure to get those questions over to the panel. So shall we start with Raj, if you'd like to just introduce yourself?
Hi guys, I'm Raj. I'm a foundation doctor in the northwest of England, in Lancashire. Can I just check if everyone can hear us? If you just want to comment yes on the comments, and then Ben will be able to pick it up.
That's great. We've got a few yeses coming in there. I can hear you there. Thank you.
Great, good stuff. Thanks for joining us, Emma, and everyone else who's tuned in. I'll let the rest of my colleagues introduce themselves.
So we go over to Cameron just next.
Okay, hello all. My name's Cameron. I'm an F1 doctor doing cardiology in Buckinghamshire at the moment.
That's great, thank you. And then Hannah next, if you wouldn't mind just introducing yourself.
Hiya, I'm Hannah. I'm working in Preston. I'm on neurology at the moment. I'm an F1.
And last but not least, if you could just introduce yourself for us, Megan.
Hi, I'm Megan. I am one of the F1s working in Preston, and I am on respiratory at the moment.
That's great. Thank you very much for introducing yourself, guys. So there's been quite a lot of questions coming in over the last few days regarding some of the FiY1 positions that are starting up. And one of the really important questions that's been posed is how Foundation Year Doctors can support the incoming FiY1s. So I just wonder if any of you could provide us with a little bit of an insight into how you envisage that support been provided rather. I think we'll direct that one to Hannah, if you wouldn't mind just answering that one for us. Thank you.
Yeah, in Preston, I'm not sure what's happening because everything's sort of a bit up in the air at the moment. But with all the Preston students, we had planned a few sessions of sort of going through things that you do routinely as an F1 that you might not have done in 5th year. So the more sort of paperwork side of it, things like that. Obviously, there are no group teachings going on at the moment, so we can't be doing those. But I would say if you know any F1s that are in whatever job you're going to do, ask them for any advice. We're all quite friendly. We're all, happy to help on the wards, or if you send us a message or anything. I just sort of asked a lot of friends that I knew from years above before going into it. I'm not sure what in particular, if there's anything anyone's particularly worried about. I don't know. Is there anything?
We've got some of the team just watching for the comments. If there are any questions in particular, any particular concerns that anybody's got, if you want to comment on the feed. I know that a few of you are expecting Helen Johnson to be joining us. She will be joining us in the next few minutes. So do keep watching. She's going to be joining us a little bit earlier than we'd expected. So please do, as I say, keep tuned in. We've just got a question coming now. If you wouldn't mind answering that for us, Hannah, and that's, how is a PPE like at your workplace?
So I'm kind of out of the way of, Megan's probably the better one to answer it because she's on respiratory. For us, generally on the wards, we're wearing masks in clinical areas. If you're going to see a COVID patient, there's varying steps. So it depends on whether they're COVID amber, COVID red, whether there's aerosol generating. But I'm not really seeing many of them. So I'm just wearing surgical masks, gloves and an apron. It's probably better off going to Megan, who's actually working in the COVID areas, really.
Okay, great. Yeah. So, would you mind just adding a little bit of comment to that one then for us, Megan? Thank you for that, Hannah.
Yeah, so I'm on the respiratory ward in Preston, which is pretty much a red area completely now. We don't really have any green areas or amber areas. Everybody on that ward is pretty much confirmed COVID. And because of it being a respiratory unit, we have quite a few ventilated patients on the ward. So what we're doing on our wards is, well, in all clinical corridors, we're wearing surgical masks at all times. And in some areas, people are wearing goggles and kind of surgical caps. That's kind of more personal choice and what people feel more comfortable in. But then what we're trying to do is, obviously PPE is limited. So we are limiting, we're changing the way that we behave kind of as a team. So we have walkie-talkies inside the bays, and we'll have maybe somebody in there in full PPE. So visor, either respirator or FFP3 mask, full-length gown and gloves, who will then, once they're in the bay, if there's any little jobs to do, they'll do them. So if there's some obs to take from a patient, no matter who the person is, as long as they feel comfortable doing that task, then they will do it. So we had a consultant in a bay the other day, and the patient had some sickness and they needed some ondansetron. So the consultant took the ondansetron got the ondansetron from the nurse outside the bay and gave it to the patient themselves. So it's kind of, we're working together to limit exposure and to limit how much PPE we are using. So yeah, sharing duties as a team, which is really nice to see.
Thank you so much for sharing that, Megan. So it sounds as though there is still PPE where you're working at the moment, and that you are sort of being looked after. That's great. I just want to quickly introduce Helen Johnson, who has just come in and joined us there over the last few moments. So good evening to you, Helen. If you'd just like to introduce yourself very briefly, that'd be fantastic. We've not actually got sound with you there at the moment, Helen. I'm not sure what's... you're not muted, so I don't know why that is. I wonder if you can unplug the headphone. We've got one of our technical guys from Becoming a Doctor, I think, is going to just message you and try and give you a hand with that, Sunny. That sounded as though it was doing something.
Maybe I'll just have a quick word about PPE while we're waiting for Helen to sort out the mic. Fortunately, in Buckinghamshire, we've had quite a lot of PPE. We haven't had any shortage when I've been needing some. I think it's very important to stress that there is PPE available, and it's obviously super important. You should be using it yourself. Protecting yourself is obviously the highest priority, which is one of the most difficult things for us as healthcare professionals to realize. When you have sick patients, you just want to get stuck in, but it's very important to make sure you're protecting yourself as well as the patients, because if you catch COVID and have to go off sick, that's one less person in the team, and if you catch it and happen to spread it to others, that's obviously worse as well. So it's super important to use it, and I'm sure your trusts will have plenty of supply for you.
Just adding to what Cameron said, I think the Research Council have released some useful guidelines for what type of PPE you should be using, for example, during a rest call. So I'd definitely look at the Research Council for that. But also, all your trusts will have, all the guidelines are being highlighted across the intranet. So definitely ask your trust for the guidelines. But also, I mean, if you happen to be on call, I'm not sure if that'll be something that you'll be doing as an interim year F1. But if you happen to be in those situations, it's always worth at the start of the day just speaking to the med reg or someone in your team to go through where can you access that equipment and what the protocols are, because each ward, each area will have a slightly different arrangement, and it's sometimes those practical things beyond the theory side, the logistics of where things are in the hospital and how things work, which are more important.
Thanks. I think Helen's just trying to come in there again. Unfortunately, it doesn't look like we're getting sound at the moment. So I think we'll just come back to Helen in a few moments, if that's okay. Just for the time being then, I've got a few questions coming in for the F1s. Just wondering, in terms of what the current advice is if you develop symptoms whilst working. Do you stay off for the 2 weeks, or will you be getting a test for COVID-19?
So I have been off. I went off a few weeks ago, I think. I started spiking temperatures on the ward. It was a bit stressful. So I went home, and in Preston, I'm not sure how it is in other trusts, but we're getting tested if we've got symptoms. So I had a swab, and it was negative. My housemate is also a Preston F1, so I was told to isolate for 7 days, unless obviously I didn't feel well enough to come back. But she had to isolate for 14 days, so it's the contact that isolates for 14 days. I'm not sure about other trusts and whether they are testing, but I know we are testing people who've gone off with symptoms. I think where they can. I think there's some delay. They can only test a minimum amount of people a day in Preston, but yeah, we're testing.
Thanks, that's great. I think it'd be really interesting actually to hear from the other junior doctors that we've got on today, if that's something that's happening in the rest of the country. And if you could comment on that, Cameron.
Sure. I know a couple of people who have been tested. So I think the guidelines at the moment are if you have symptoms, you stay off. And I think they're trying to test staff in Buckinghamshire as soon as they can to try and get you back to work if you were negative. If you are positive, obviously, then you should stay home. I think the guidelines currently is if you have symptoms yourself, you stay home for 7 days or until your symptoms resolve. And anyone in your household then stays off for 14 days. So I know people in my team are off currently and have been tested. Unfortunately, some positive. So, but the tests are being done if necessary. So obviously, advice would be if you're symptomatic, stay home, speak to your occupational health team, speak to your infection control team, and they'll advise you whether you need to be swabbed or not and tell you how many days you need to stay off, etc. So yeah, if you're symptomatic, stay home, speak to your occupational health team.
I'm just going to check whether you can hear me now.
Brilliant.
Yes,
we've got you there, Helen. Nice. Loud and clear. Welcome. If you'd just like to, thank you for that, Cameron. If you'd just like to introduce yourself quickly, Helen.
I'll do it really quickly. I'm Helen Johnson. I'm the Foundation School Director for East Anglian Foundation School and the EBH Foundation School. I'm in charge of allocating everybody for their FiY1s to they're working out how they're going to work, which is a movable feast, and answering lots of questions. So I can see there's lots of questions already on there. Did you want me to start with what's on there, or did you want to ask me directly?
So the first question I actually was going to ask you, if you wouldn't mind, is when will the FiY1 contracts run until, and will there be some time off between FiY1 and FiY1 move on to the new deaneries?
So that's up for discussion at the moment. We are having a large discussion with NHS employers and our trust in that we'd quite like the contracts to run until 2 weeks before August, so that everybody has the opportunity to take 2 weeks as leave before they restart, if they wish to do so. So that is a current hot topic, really.
Okay, that's great. So there is going to be a little bit of a break, if only the two.
That's what we're aiming for. Obviously, HEE isn't the people in charge of contracts. It's NHS employers that are in charge of contracts. One of the difficult things about FiY1s is that there are 4 governing bodies for this. There are the Medical Schools Council, the GMC, HEE and NHS employers, which is why some of the information has taken quite a while to come out, because with 4 different people with different ideas, it doesn't necessarily happen very smoothly.
Great. Sorry. Go on.
No, that's fine. I was just looking at the question about accommodation and so forth.
That's great. If you would like to address that question, is that the one by Rosie?
It is Rosie's question. Yes, this is again conflicting in that accommodation is part of contract with NHS employers rather than HEE. So as HEE, we very much suggested that they all should consider offering the accommodation that they currently have vacant from their medical schools. And if they do need to provide accommodation to keep the costs minimal, I'm hoping that most of the trusts in East Anglia will go for a free accommodation option, but it's not something that I can mandate because that's through NHS employers.
That's really useful. Thank you for addressing that one for us. So it seems that there's quite a few questions coming in about the allocations. I'm just looking through those at the same time as you are, I'm sure. So I just wonder if you could answer us. Sorry, just a moment.
Okay, so I'm just going to run through them. So the start dates are very variable. We're handing allocations to our trusts. So we handed the second tranche of allocations to our trusts tomorrow. And we're anticipating that most of them will hope people will start next week. And they've got their inductions planned for a next week start. But they are going to take starters later than that. We are currently videoing most of our induction materials so that they can be done later. Those that are stuck abroad with no flights back, if you can't get to do an FiY1, you can't get to do it. There's no terribleness to that. When you get to come back, then contact people and say you're now available, and they'll see when they can fit you in. Discussions about FiY1 starting in waves, I think that is what's likely to happen. I think with medical students graduating at different times, it would be silly for us to all wait until the very last medical school, because that would mean lots of people have been sitting around rather than helping when they wanted to. And some medical schools are quite different to others, so we're quite happy to do some starting in waves, really, particularly in East Anglia. We're all geared up for that. Will the contracts be sent to you when you're finalised? Yes, I would love to see what the contract looks like. That's with NHS employers, and they haven't shared it. But the difference is from F1 plan to be that you won't be expected to do nights, and you will have a 48-hour notice period to resign from. I saw that bit about whether the 2 weeks includes your shadowing week. I imagine it's before your shadowing week, but if you've done FiY1, do you really need to do a shadowing week, or are you good to go? I think you're probably good to go. So that's one of the things that is part of the discussion going ahead. When do I anticipate I'll recruit the last wave of FiY1s? Do you know what? If you're an FiY1 that's starting in the trust that you're going to go until August, I think there'll be no last date. If you're staying by your medical school, I think the trust will probably suggest that you need to do at least a month with them for them to go to all the effort of doing all the recruitment. So maybe mid-May, mid-June, who knows, but mid-June rather than mid-May. But we'll see what our trusts want to do, because actually they're the employers. So we might offer them FiY1s, but they're allowed to say no to anybody that they want to. Do I expect that FiY1 posts may be offered in areas other than just 2 options? No, I don't, because it's causing utter chaos to do it with just 2 choices. And I think if we offered any more, it'd be completely impossible for us to get you into posts with any kind of reasonable time. Once you're allocated to a hospital, is there any flexibility about location? Pretty much. No, I don't think so. Again, because the fact that because there is COVID-19, I used to be part of a team of 8 and now I'm a team of 2. And so I'm allocating all of these posts personally. How many hours will they be expected to work a week? Probably the 40, maybe up to 48, but it won't go above that. And actually there is probably some option for flexibility. I've had a couple of my trusts agree to have some as less than full time. Will you get any vacation in FI year one? That's an NHS employers thing. I would hope so, but I don't know. Rough estimate on pay, it will be the F1 salary. And so the likelihood is that you will get the proper F1 salary. There's no out of hours late at night, so that may make a small difference. In my trust, which departments are FI year one doctors allocated to, hot or cold areas? Do you know what? Most of my trusts are predominantly hot now, so we're going for lukewarm. We're not putting them in the hot areas, but there are very few cold areas left. If somebody really needs to be shielded from COVID, we'd suggest that they just don't do this, and that they look after their own well-being instead. Which specialties will you work in? You're working in step-down medicine. There are a few other specialties going on, like obs and gynae and peds. But what we're probably doing is buddying most people up so that you're in a group of 2 or 3 FI year ones and 2 or 3 F1s, F2s, and working as a team. You'll never be on call on your own then, because you're part of a team. So the first month is planned to be enhanced shadowing. So you're basically working with the group, doing jobs with the group, but they're all helping you out. Hi Helen, should all applicants submit their applications to East Anglia last week? No, you haven't. We have only done the very first easiest ones because I just wanted to get some out there and see how it worked. So I think only about 60 people have heard, and I've got another 200 odd to do. So don't worry, Mike.
Sorry, Helen, can I just interrupt you just for one moment? I've just got another question. We're streaming on a few different platforms, you see.
Okay.
And we've also had questions coming in over the last few days. So I've just got this a question coming in now, specifically for you. And I've not got the name who this is from, but the question is, I'm starting as a clinical assistant at James Paget University Hospital. Some others students in my cohort from UEA are also starting this week in FiY1 posts. We'll be doing very similar jobs, but they seem to have education and clinical supervisors. They're much more supported than us with higher pay too. I wondered if there could be any update on this. How many FiY1 posts are there? Are there enough for everyone?
There are definitely enough for everybody. We're matching the FI1 posts with the number of F1 posts in each trust, and at that point there is a bit of spare capacity in our trust should they need to go over. So if you've applied for FI Year 1 and you put James Paget as your prime choice, the likelihood is that you might get James Paget. We've been quite clear on our website though how we're allocating. So we're allocating as a priority to the trust all the people that are going there in August, because it seems silly to move to the region and then move yet again. And then the second group we're prioritising according to how they've chosen on the medical school survey with UEA. And for Cambridge, the Cambridge told people that they'd already been allocated to trusts, and we're using a mixture of that and people's preference on the UK FPO survey to try and come to a best fit solution.
That's
did
great.
That answer that? That
did answer that. Thanks so much. And just another question that's coming now, just about the difference in responsibilities between F1s and FIY1s. I just wonder if we could clarify that a little bit, what, if any, the differences in responsibilities will be.
I think the difficulties in responsibility will be due to having worked in the trust for all of that time. So effectively you will have the same ability to have those responsibilities, but we're using the first month more or less as enhanced shadowing. So you won't be on your own, you won't be managing your own caseload, you'll be doing it as a group with others. So you still will be able to prescribe, do fluids, do discharge summaries. We're limiting, hopefully, the difficult things like taking blood with full PPE on, because actually that isn't as easy as it sounds. So I think it's more about looking after each other and making sure that you're all supervised and supported. And then as your confidence grows, you can pick up being more of an F1 and lesser than a nearly F1 according to your own trajectories. Sorry if you can hear my kids rowing in the background.
No problem. It's the joys of COVID, I'm sure. So just another quick question that's come in now about the PSA. So I know we've sort of talked a little bit there about the month shadowing. Is there a role for the PSA? What do you sort of envisage there to be in terms of prescribing for new doctors?
Actually, from the UK FPO, I thought that if people hadn't passed the PSA, they weren't going to be allowed to do FI Year 1. So I can check that up for you, but I thought everybody was going to have had to have passed the PSA to do this.
That's interesting. I think at some schools, I don't know whether they've sat the PSA and yet they've graduated. So that's quite interesting. It'd be great to follow up with that if that's possible.
It's not such a big issue for me in the east of England because we have a variety of alternative supports. If you haven't passed the PSA, but I had thought I wasn't allowed to make an individualised decision on that. And we quite like the Northern Ireland purple pen approach, that if you're a new prescriber, you use a different colour so that people can easily spot it and check it. I know everybody should be looking at it all really carefully, but we also know that everybody is really busy. So if you have a different colour pen that shines out until people have said, no, you've got this, then it helps with prescribing safety.
That's great, thank you. We've just got another question coming from Twitter now. Is there any chance that FiY1 contracts could be made extendable to an F1 contract for that local trust and have us transition to our nationally allocated F2 trust after?
No.
That was a nice short and sweet answer. Thank you. Just got a few other questions coming in here. So yeah, there's the confirmation of that's quite a few different schools are using taking their PSA at different times. I just wonder, we were having a little bit of a discussion prior to coming into the studio about PPE and sort of the prevalence of PPE in the east of England. I wonder if you could comment on that.
Well, no, probably, in that because I'm shielded, as you've probably noticed, I don't have any overt knowledge of the PPE problems that might be happening in the east of England. None of my trainees have written to me to say that it is a big issue for them, and all of my trusts have been very proactive about PPE. That doesn't mean that there hasn't been risk areas, though.
Okay, that's great. And a question I've seen a couple of times now is that if people decide not to take up the FiY1 post, do you think that they may be at a disadvantage at some point in the future?
No, I don't think so. This is totally voluntary. There are lots of reasons for not taking up an FI Year 1 post. You may not feel ready, you may be shielded, you may have family members that you need to look after. This isn't something to be terrified about worrying and doing. So I think you should just only do it if you actually want to do it. Don't let peer pressure push you into it.
That's great, thank you. Just got a question now from Rowan Sant. If you can't start FiY1 immediately, but can start later, for example, May or June, is there an option to state this, or would you recommend just signing up later?
I'd probably recommend just signing up later, to be honest, so that you can start when you're ready to sign up. But if you've already signed up, then when the trust contact you about your start date, you'll need to tell them that you plan to start later than that. Don't worry about telling the foundation school, because we're not sort of the people that worry about your start dates.
That's great, thank you very much. I'm just going to take a question now for one of the junior doctors. We've got a question coming in now. Seems to have disappeared, but basically just asking what advice that you'd recommend for the incoming junior doctors in terms of preparation for their new position. And if I can direct that one at Megan, that'd be great. Thanks.
In terms of preparation, I think being aware of the trust that you're working in, if there are any specific things that are particular to that hospital. For instance, do they work online or do they work on paper notes? But that's all kind of comes in your induction. I think medical school, it prepares you in some way, but you can never fully be prepared until you start working. And I think you have to accept that. And there is a lot of fear that goes into it, but you realize that all these other doctors have done it before you. Like, I didn't feel prepared going into it at all. But using that shadowing period to try and pick up any tips you have about how to use the systems or how that particular ward works, I think that's really useful to understand. But I think trying to prepare too soon without actually being on that ward or being around those people you kind of just can you get yourself a bit too anxious before you actually get there. So I say stay calm, use your time off to relax, and don't get too caught up in being a doctor just yet. I mean, obviously there's this new opportunity to be more involved at the moment, but I think for the moment, just use your time to relax, and you've worked hard, like it'll pay off. And I think actually being a doctor gives you that purpose that I think can be missing sometime in med school. And for me, it was a massive morale boost. I felt really enthusiastic about going to work every day. I felt like I was finally able to actually make a difference, and I had a purpose on the ward. I just wasn't like getting in the way, which I felt like I was a lot of the time in med school, which you're not, but you feel like you are. So I think, yeah, relax and look forward to it. There is a lot to look forward to, and it's what you've been working for. So you'll figure out all the ins and outs and that sort of stuff on in your induction and your shadowing, and the rest of it will just come with experience and time.
Thanks very much. I'm sure that's quite relieving to hear for a lot of people tuning in, probably quite nervous about the looming start of this new venture. Just one more question now for Helen, if you wouldn't mind. It's just a question on holidays, actually. So if the incoming doctors decide not to have holidays at the end of FiY1, can they go straight into the F1?
Since this is still being discussed currently at UKFPO, I think we haven't got a definitive answer. As I said, it's quite difficult to explain the difference between what HE and UKFPO can decide and what NHS employers can decide. And so things like holiday pay and sick pay and holiday entitlement are all an NHS employer's issue. So although we advise, we actually aren't in charge of any bit of that process.
Okay, thanks very much. And another interesting question now, will the FiY1 count at all towards the F1 year? Not
in time, but the competencies they acquire can count towards the ARCP at the end of F1, but they will still need to finish at the end of July of the following year. So it's not time counting, but it is competency counting. And that was partly so that we didn't discriminate against those that couldn't do FiY1.
Of course, with it being on a voluntary basis. Thank you very much. I'm just going to take another question now for one of the junior adapters, and that's how are you supporting each other working in this environment? And if we can have that one from Raj.
Hi, Ben. So I think at the moment, but as always at all times, we have a really good team structure around us, and that's just not doctors. That's everyone in the multidisciplinary team. Nurses, physios, pharmacists, ward clerks, everyone, and you'll soon get to know them more when you start in your placements. So I think getting to know them well. This is a tough time for everyone. No one's dealt with something like this before. So I think it's really important to kind of know that you can reach out to anyone. It doesn't need to be a doctor or a consultant or MedReg. Everyone's there to support you. And I think from my experiences and from my colleagues, I think everyone's been really open, especially to people in your position you're just starting as a junior doctor. And a lot of people have been in that position before, and we really want to help you succeed and make sure you feel supported. And I guess that's why Helen's taken time out today as well to join us, because people like Helen really care about you. That's why they do what they do. They really want to make sure that you feel supported and that you have the tools to succeed in what you want to do.
That's really great. Thanks so much for sharing that with us, Raj. I think, like you say, you've hit the nail on the head that people like Helen and yourselves actually really want everybody to succeed and proceed onwards in their career as doctors. So we've just got another question coming in about student finance and NHS bursaries. So during the FiY1 post, I'm assuming that's potentially a paid position, but if we could just go to the question by Juliet Murphy. I wonder if you can provide us a little bit of insight into that, Helen.
Well, FI year ones are totally paid. I believe NHS bursaries have decided to continue paying through that period, which actually is quite generous of them because they don't have to. But that again is something that's outside HE's line of fire, really. But I believe that they have decided to continue paying that. But you will be getting a proper working salary as an FI year one.
That's great. And just another question on pay. So the BMA rep for 7 indicated that online e-learning forms part of the induction and should be paid. I wonder if you can provide any clarification on that, or any opinion on whether or not e-learning will be paid for.
I think that since you're still getting the NHS bursary and you might want to get done in ahead of starting, I would just do the online induction. It's 1.5 days worth at most of e-learning, and most of us have done our statutory and mandatory e-learning very, very quickly in far less than the 20 minutes each that they say that it should take. This is a pay and conditions thing though, so if anybody wants through the BMA to take this up with their local employer, they could do so. But NHS TEL and HE together have worked to create this induction package mostly for your benefit, rather than to put you in some kind of terrible position at having to do lots of work before you start. We actually have thought very carefully about what's in it to try and make it as advantageous to you for a quick start as we can. And it's what it's called fast track into foundation. But it's up to you. And yeah, Isabella, I would just start doing the fast track modules now. They were created so that you could start them whilst waiting to see where you'd been allocated.
That's great. And there's another question in about salary, which you can probably see there yourself, Helen, about when the first paycheck comes in. There's quite a few on salary, it seems, this evening. I wonder if you've got the answers to that.
It's such a shame because this isn't my area of expertise. You need an HR director for this, but actually most NHS salaries are paid in arrears, so you'll be getting the salary at the end of the month that you start in.
That's great. I'm just sorry, go on.
No, that's fine.
I've got a question about allocation. So one of the Twitter followers has tweeted in, if they're not happy or comfortable with the hospital they've been allocated to for the FiY1 through their medical school, can they then apply through the foundation school instead for an FiY1 position?
Do you know what? This is a really difficult one because I guess they probably could, but actually as the person that's having to personally do all of these allocations, I would be quite unhappy if I have to juggle lots of people back into different spaces. So practically speaking, you can, but realistically speaking, I then may not get to redo you.
Okay, thank you very much. And just quite an important question coming in from Laura Ola there about where the e-learning is available from. So I don't know if any of the junior doctors or Helen, you can provide an answer for that.
It's on the COVID-19 bit of e-learning from e-learning for healthcare, and you can find it on there, and it's the Fast Track Foundation, and I have a link to it from our East of England FI Year 1 webpage so that people can click on it and go through. It's the doctors in training. It's a reduced bit of stat and mand, and it is 2 sections out of the foundation e-learning.
Great, thank you. I just wonder now if there's, we've got a few other questions coming from the Twitter feed here. So when will the incoming East of Anglia FY1s find out about FiY posts, and will accommodation be provided? There's quite a few questions actually coming in about accommodation. I don't know if you're aware of any provisions for accommodation for the incoming FiY1s.
So many of our trusts have said that they're going to look for accommodation. We put it in our query out to the trusts, would you be providing accommodation? And most of them said if it's required, we'll be able to provide it. So it's a question they then have to take up with their actual trusts that they work in, because of that whole thing about contractual rather than educational. But to my best knowledge, all trusts are going to have accommodation available to them. When will they find out? It depends how quickly I can get through the allocation, but I'm hoping to have completed this next batch by Thursday, so all of the emails will go out Thursday or Friday. But I am interviewing for F2s all day tomorrow and all day Thursday, so I am doing this when I finish the call. So I think it is really hard when you think that there's a massive team doing this work, but UK FPO itself is only 4 people at the moment, so there's no massive teams here. They're only individuals just doing their best, really.
Thank you. So it sounds like you're keeping just as busy as ever, trying to get everybody into their positions. Just a question on if you've applied to a particular deanery. This is from Pat Molden. It should have popped up on the screen there. So if the deanery which you've applied fills up, will you be informed about this and then have the chance to apply elsewhere?
I'm thinking that most deaneries aren't going to fill up, but yes, I guess you would have the chance to apply elsewhere. For our own deanery, our EBH deanery is mostly empty because it has no medical school, and our East Anglia deanery, I guess, is at 75% fill. But I've asked all my trusts to have with them a 10% of overspill capacity, so that we probably can fill to another 10% without being worried about being overly full if we have to. And I think most deaneries have done something pragmatic on that basis.
Great, thank you. And in terms of support available from the trusts, what sort of support is in place? So that you've said that there's a month's shadowing. Logistically, sort of how many doctors will be sort of overlooking the FiY1s as they're coming in?
So the plan is to get all the FI year ones in a pair or a triplet, and then give them a pair or a triplet of F1s and F2s. And so that on all their shifts, they're buddied up at least with one, but usually 2 or 3 of those F1s or F2s, so that they feel comfortable with that. This little group will then have a clinical supervisor who's providing the senior support. Most of my trusts are at the moment getting middle grade and senior trainees to be mentors as a group to support them in, and then the foundation training program director with some educational supervisors plan to hold ideally weekly, it just does depend on how busy they all are, but weekly drop-in sessions or weekly Zoom calls to catch up with all the trainees in the trust for question and answers. We've put our mentoring training program out on our website, so all our F1s and F2s can do the mentorship training, and HE is also putting on a national mentorship training, but that hasn't quite finished being designed yet, so that will come out a bit later. Our PSW, Professional Support and Wellbeing Service, is currently open for all doctors of all grades, whether in primary or secondary care, to refer at any time in by self. And so that's available for our FI year ones if they need a little bit more additional support.
Thank you very much, Helen. So in terms of the actual support that's coming in and available for the incoming junior doctors, it sounds like there's quite a lot of provision there, actually. Is this more provision than would ordinarily be the case, or how does this compare to normal?
I think it is probably a little bit more than would be the case, in that the teams are now flexible and fluid. So we've always tried to run with an F2 to F1 buddy in our East of England schools. Various trusts are better at this than others, though, which is why I'm saying it's aspirational, in that we hope to embed it. And we were hoping to embed this year a senior mentorship buddy for them all as well, which we've obviously put a hold on because of COVID. So I guess it's a little bit more. Some of it is what we were hoping to do anyway come August for our new F1s, and we're just bringing forward in a different way. And some of it is just trying to put in belt and braces to make sure that even if an element of it doesn't work all the time, there's at least the other elements that should keep it going.
Thank you very much. I'm sure that's, again, quite comforting for the incoming doctors to know. Just a quick question now from Tash Denbury. If the new doctors are coming back from abroad to start the FiY1, will they be required to self-isolate for 14 days, or will they be able to get tested? What's the current guidance surrounding coming from overseas?
I think that's actually a really tricky question, and I'd suggest that they just approach the occupational health of the trust that they're coming into, because it does depend on where they've been, who they might have met, where they are, when they manage to come back, and also the risk that the occupational health has against their own personal welfare too. So I would say that's an individualised plan.
That's great. Thank you very much. I'm just going to take a question now for one of the junior doctors. And that's from Bertie Catherine Whitley. Question being, do you think your seniors are aware of the incoming FYI and the differences in responsibilities? And if I can go to Cameron for that one. Thank you.
To be honest, I'm not really sure. I don't know if we're going to be receiving FiY1s in my trust. I'm in Buckinghamshire Healthcare Trust, so we have Oxford Medical School and the Buckingham Medical School. I'm not aware if they're bringing any in personally to my area. So I'm sure that my colleagues are aware of this. I've actually talked about it to them myself, so I'm sure that they're aware of the scheme that's happening, but we don't actually know if we're receiving FiY1s yet to our team. But I don't personally know yet anyway. So sorry, that's not very helpful.
No, thank you very much. I wonder if any of the other junior doctors can comment on that, if you can just give us a wave if you... Or Raj, have you got anything that you can add to that at all?
I think, as with anything, I think it's always okay to say that you don't know how to do something, or you don't feel comfortable to do something. I think as medical students or as medics, it's quite easy to say yes to everything and then think about it afterwards. But it is okay to say that you don't feel comfortable doing something in terms of responsibility, and then asking someone to show you. But also, I think it's about recognizing our limitations. You know, we're not all great at everything, and competencies take time to build on. So no one's expecting you to know it all, or know, to be able to do every skill just because you might have done it during medical school. So I just make sure that you take a step back and always make sure that you don't feel pressure to do something that you don't feel comfortable with.
Yeah, I think that's a really important point to make. Just ask. It doesn't have to be one of the other doctors. It can be one of the nursing team. It can be one of the pharmacists. If you're querying about a prescription you're writing, everyone's there to help. You're one team together, and just if you don't know something, just ask.
I think that's a really important consideration, guys. You know, that making that transition from a final year medical student into a junior doctor, it might feel to some people like there is, this sense of responsibility, but as you say, it's very much still the case. If you don't know something, you can ask, and there are always people there to support you in your decisions and any questions that you might have. So we've just got another question coming in now from Akshaya Mathialagan. I hope I pronounced that semi-correctly. So how will the inductions work? I think this one's for you again, Helen. How will the inductions work if people are starting at different times? Will it all be online, or is there any current provision for in-person inductions?
We've actually asked all our trusts to do a minimum of a half-day in-person induction, so that you do actually get to see some of the people that are key looking after you. But we have also suggested that they video most of the induction that is happening beforehand, so that you actually get to see some of it as online and video. And I think that is probably going to be different across our East of England trust, but also across the country. Certainly our most London-facing trusts have much less time to run big induction programmes than some of our more northerly trusts. And certainly as you go out from the big cities, that seems to be the case. So I think there's not a one-hat-fits-all. But what we are clear about is that what we might not be able to do in the induction, we're going to be able to cover with enhanced shadowing. So some of the skills that may be taught through in induction, you'll be picking up by being shadowing and buddying up and with existing F1s and F2s instead.
That's great. So I think it seems like there might be concern from some of the people that, that they might be missing out on induction if they're not starting at the right time. But it sounds as though it's been well thought out and that all the bases have been covered, really. Just another question from Alex Lee this time, just to confirm the induction start date for East Anglia in particular. I think we've got quite a few people that have tuned in from East Anglia there to have a listen to you, Helen. So we're just inquiring there whether the induction start date is from the 20th of the 4th. And I can't quite understand the rest of that comment, but I just wonder if you could provide us with a bit of clarity about the induction.
So I guess different trusts are going to run their inductions at different times. When we first heard about FI Year 1s coming, we actually had hoped that we would be able to get all the data in so that they would be in place for the first week of April. And because of the difficulty in the 4 different bodies in agreeing what these might look like, it's obviously taken a lot longer. And so I think some of the trusts did originally have induction dates planned. And so if we get them in by the 20th, they'll probably run an induction in the 20th for some of them. But actually start dates are always negotiable. And so I think anybody that's only finding out on Thursday or Friday will find out at the same time as their trust. And I think they should negotiate whether you want to be in a first wave induction or wait for a next one. Most of our trusts are expecting me to give them this information on a weekly basis and potentially have to run weekly inductions.
Great, thank you. Just another question. This one's a bit more about the sort of shifts that the new doctors can expect to be working. Some people have been talking about the fact that FiY1s won't be working nights. Is that something that you're aware of? Or?
Yeah, absolutely. There are no night shifts for the FI Year 1s.
And will they be on call on their own on the weekends at all?
No, because they're always going to be buddied up. So they're going to be allocated as part of the team, at least certainly for the first month. But actually, most of my trusts aren't running original looking rotas at all now, and they are running a very team-based structure. So actually, I think there's very few doctors left that are not part of a bigger group. And so they're being on call on your own is becoming less and less of a thing at the moment.
Okay, that's great. And just another question from Josh Withers this time. Will the incoming doctors be purposely avoiding the COVID wards, or is there any prospect of them going on and working directly with COVID patients?
I think in some trusts there are really approaching 0 wards that we would consider as being COVID free. But we're certainly not planning on putting them in the COVID hot wards, ICUs, and where NIV is going on. But they are likely to be in what we call lukewarm wards. And I think that's why we're quite keen that anybody that needs to be shielded or avoid contact with COVID should rethink whether they should be volunteering. It is fantastic for you to agree to volunteer, and we're all very grateful. But people's own health is also very important. And since we can't guarantee that you're not going to be somewhere where there is COVID, then you need to bear that in mind when you sign up.
Okay, thank you very much. I think you did sort of explore that actually a little bit earlier. And just another question now on the specialties that the incoming doctors might expect to be working in. Are there any particular specialties that are sort of off limit? I know you've spoken about sort of the hot areas, but in terms of actual particular specialties, is there anything that that they can expect to be doing particularly more than others? Or
in our area, and of course, as foundation school directors, we are fairly individualised sometimes in this. We have moved all our F1 psychiatry into the acute trust, all our GP F2s into the acute trust, and may or may not be going to be moving all our F2 psychiatry into the acute trust. And therefore, if we don't have F1s or F2s in that placement, we won't be putting FI Year 1s. So for us, we're not intending to put FI Year 1s into psychiatry unless there is a sort of medical reason why we might choose that. And for specialties, I think actually if the trust can support them, I would have them allowed into specialty areas where they wouldn't normally go, such as obstetrics and gynecology, if the trust can provide the right supportive environment for that time there.
That's great, thank you. I'm just waiting on, I think most of the questions that have come in now, you've answered one form or another, so I'm just looking through the questions now, see if there's anything else that we can add in there. I'm just wondering, in the meantime, if we might be able to go to one of the junior doctors just to talk a little bit, if anybody could offer us a sort of top tip I know we heard briefly from Megan, Raj and Cameron. Perhaps if we can have a few words from you now, Hannah, on what your top tips might be for the incoming FiY1 doctors.
Yeah, I think everyone else kind of covered it really. It is always going to be a huge jump from medical school. If anything, this is a really nice way to sort of ease yourself into it a bit. It is very different from med school, but you get used to it really, really quickly. So just breathe, speak to people, ask for help, not just asking for help, just to get a nice environment to work in, and you'll be absolutely fine. Everyone is fine. It feels like a really big jump, but just relax, enjoy it, ask for help when you need help. And yeah, the F1s are always really helpful. I found, maybe I'm not that helpful, but yeah, you'll be absolutely fine. Just enjoy it.
Thanks very much. Just one more question now for you, Helen. Thank you very much for answering that one for me. This question is on whether or not there'll be any complications or issues if the incoming doctors decide to drop out of the interim FiY1.
No, absolutely not. This is volunteering. Many of our FI Year 1 doctors are not knowing what they're actually volunteering for, and part of that is because actually the situations within trusts, as all the doctors already in training will be able to say, is actually changing on a regular and fairly frequent basis. And if how the changes work do not suit you, or you are finding it stressful, or you have changes in your circumstances, by all means choose not to volunteer anymore, and there will be no sequelae for you when you restart in August, because August onwards is your actual start date. And before that, you are benefiting the community, and you may choose not to do that at any time. If that's all right, I'm just going to answer some quick questions on the side that caught my eyes. So Dina Davis, who wonders whether she's got any choice of hospital allocation if she's pre-allocated the foundation school. Most of us at foundation schools are going to try and are pre-allocated to the same trust that they were planning to go to, and that's because we mostly, when we pre-allocate, try and pre-allocate you one of your top 10 choices. So we hope that if it's one of your top 10 choices, it is somewhere that you actually feel would be useful for you to go. And so I'm imagining you'll go to one of your top 10 choices. If it really doesn't suit you, then let people know, because the people that have specific requirements are the only people that I can cope with emailing me at the moment and asking. AC Mars, the people, and Sky Young, about August rotations, we don't know what's happening in August yet. It's really too hard to predict. If COVID is completely settled, then you'll be doing your normal jobs. If it hasn't completely settled, then we will be making pragmatic, rational decisions between now and August as soon as they become clear about what's required for you to do. And I think that goes with everything I've said today, is that a lot of it's based on what we think we're doing now, but what we think we're doing now may be different in what we actually need to do in a month's time, and we will be being reactive to that. All we will always try and guarantee is that we support you well and provide the right environment for you to work in.
Thanks so much for whipping through those last few questions. Just before we wrap up, because we've got only a few minutes left of our webinar, and I know that these guys have all been working in one capacity or another, whether it's dealing with the incoming FiY1s or on the wards. I know everyone's been really busy, so a really big thank you to all of you for joining us this evening. I'm sure it's appreciated by everyone, including us over at the Becoming a Doctor team, of the input that you provided this evening. I'm sure it's been invaluable for those listening in. Just so those of you that are listening in are aware, we are currently about to start in the next few minutes a Med Student COVID Twitter chat, which will be addressing some of the other areas of concern that people might have. We're particularly looking over what sort of initiatives medical students have been starting during this time, and we're also looking at how to get yourself motivated if you have still got upcoming exams and that sort of thing. So if you head over to Twitter now and follow the hashtag MedStudentCovid, you'll be able to. Thank you, Tanya, just slotted that in there. Yeah, so use that Twitter hashtag, I was going to call it handle. You can find our handle actually, Becoming a Doctor, So it's at Becoming a Doctor. And if you'd like to head over to our page and like our page, that'd be great. So you can keep up to date with other webinars such as this. We're also planning on doing some teaching and that sort of thing as well. But it's really, really great to have all of the doctors that we've had this evening. I'm sure you'll all join me in thanking Megan, Cameron, Hannah, Raj, and of course Helen for taking the time out of their busy schedules. Please do now head over to Twitter though. The conversation is carrying on. There's some important things coming up on there. I want to help you guys keep motivated during these challenging times and help you where we can. So thank you once again for tuning in, and we look forward to chatting more with you on Twitter.
Okay then, thank you. Bye bye.
Thank you. Bye bye.